All right, here we are doing some SMR to the hip adductors. As you can see right here. And what you can do, you want to make sure you're rolling over it nice and slow. You don't want to be too fast because that will cause further excitement of your overactive muscle, and the whole point of SMR is to inhibit those overactive tissue. And one thing to note is you can increase the pressure by adding more weight. This is enough pressure for me, so I have a lot of my weight in my elbows, so I'm decreasing the pressure on my adductors, but if I needed it to be more, I could increase more of my weight into my leg. Let's go. All right, so as seen in the previous film, the SMR technique was for the hip adductors, and the SMR is used for muscle tightness and pain, or pain due to exercise, to reduce the overactivation of those muscles, or to prevent muscle tightness and that pain before exercise as a warm-up. As for preparation, make sure that your posture is properly aligned and maintain that drawing in maneuver by pulling in your belly button towards your spine to provide stability to your lumbopelvic hip complex. And then you may use your own extremities to alter the amount of weight on the treatment area to either increase or decrease pressure. Make sure you don't roll over the SMR device too quickly because it may cause further excitement of the tissue, which is not what we want, because we're trying to inhibit it, not activate it. So make sure you just roll over the device slowly. And then make sure you ensure that the client is relaxed, because tension in the tissue being treated prevents the roller from really penetrating into the deeper layers of the soft tissue. Make sure to tell the client to pause on the rolling action over the painful areas until a sense of release, or until the pain subsides and the tissue will soften, which will be about 30 seconds with maximal pain tolerance, but maybe about 90 seconds if it's lower pain. And then lastly, SMR treatment will become less painful as soft tissue restrictions break down over multiple SMR sessions. And make sure you're going to hold it for, again, about 30 to 90 seconds, depending on the intensity of the application, for about one set daily. And some precautions and contraindications include if you have a congestive heart failure, kidney failure, or any organ failure, bleeding disorders, or cancer, please consult your physician before performing.